guests. The tradition of having a mace in higher institutions of learning comes from parliaments having a mace, a symbol of authority. And that itself traces back to the Roman Empire, where the tribunes of the people carried a staff or a rod that was a symbol of their authority. And the mace in our college represents our authority to grant you these diplomas, to set standards, and our authority to make you fellows or members of the Royal College of Physicians and Surgeons of Glasgow. So welcome to this evening's ceremony. I'll say a few more words later, but now I'll invite the college's Honorary Secretary, Dr. Richard Hull, to come to the stage.
Thank you, Mr. President. Would those people receiving diplomas please stand? This is the oath of allegiance to the college. Do you solemnly and sincerely declare that you will be faithful fellows and members of this college, obey all laws, regulations and bylaws made and to be made by the college, and will do nothing which, in the opinion of the college, is prejudicial to the interests of or derogatory to the honour of the college or of your profession? I do. Thank you. Would you please be seated? I would like to invite Dr. Sam Allen, physician, Dean of the Faculty of Travel Medicine, to present the diplomas to all new medical fellows and members. Unfortunately, Professor Andrew Gallagher, Vice President, is not well. We'll just let people. Irfan Hassan. Sabani Sengupta. Arsan Zahid. They're all new fellows, qua physician. Membership qua physician, MRCP Glasgow. Divya Mangal. Paul McClymont. Membership of the Royal Colleges of Physicians of the United Kingdom. Greg Bowie. Sophie Coleman. Michelle Latter. Erin McCann. We now turn to surgery, and I'd like to invite Mr. John Scott, Vice President Surgical, to present the diplomas. The Intercollegiate Specialty Fellowship in General Surgery, FRCS Glasgow General Surgery, and the first recipient also receives the Teesdale Medal, which is for performance in this, the highest performance in this exam by a Glasgow applicant. Erin Catherine McElveen. Lasithia Bagia Samarakun. Fellowship qua Surgeon FRCS Glasgow. Safdar Alam. Terence Jose Jerome. Vijay Malshikari. Jawahar Lal Singha. Fellowship Qua Surgeon, FRCS Glasgow by-election. Thisara Weerasurira. I'll get it right. Ramya Metla. Hasika Ravula. Membership Qua Surgeon, MRCS Glasgow, Ahmed Ali Ibrahim Abuzalat. Mustafa Beshra. Anuj Lal. Membership Qua Surgeon in Ophthalmology, Marwel Mutwaki Mohammed Ahmed Mohammed. That completes the surgical diplomas. I now invite Professor Christine Goodall, Vice President Dental, to present the diplomas to all new dental fellows and members. The Intercollegiate Specialty Fellowship in Oral Surgery, FDS Oral Surgery RCPS Glasgow, Neil Donaldson. Fellowship in Dental Surgery, FDS RCPS Glasgow, Kieran Ewan Moore. Intercollegiate Specialty Membership in Orthodontics, IMOrthRCPSG Glasgow, Harshad alias Anant Ashok Gopadi. Membership of the Faculty of Dental Surgery, MFDS RCPS Glasgow, Katie Huane. Joshua Jackson. Gavin Singh Malhi. Ashiwin Nehru Das. Shakira Samsuri. That completes the dental diplomas. I now ask Ms. Deborah Wilson, Vice Dean of the Faculty of Podiatric Medicine, to present the diplomas to all new dental fellows and members. Fellowship of the Faculty, sorry, I said Podiatric Medicine, I do apologise. Fellowship of the Faculty of Podiatric Medicine, Mugnia Boumenjani. Caroline Leverett. That, Mr. President, concludes all admissions for November 2023.
Could you come and get a seat? As the Registrar and Acting Registrar, our Honorary Secretary, Richard Hill, read out your names and you came up onto the stage and squeezed behind him and came across here and shook my hand and picked up your diplomas. everybody applauded. And so they should have done, because you have achieved a very high standard. You have set yourself a high bar. You've come home at night, studied, turned on desk lamps and opened laptops and textbooks, and you have prepared for exams and been found to be of a sufficient standard to be granted a membership or fellowship diploma of this Royal College. So you deserved our applause. But I would suggest to you there's some other people with us this evening who also ought to be recognised. They're sitting up here in these seats behind you, and they are your families, your wives, partners, husbands, your mums and dads, and some children also, I think. They're being very well behaved though, so that's good. We'll not mention them in case they erupt. But I would like you now, in what's become a tradition in our college, to join me in standing up, turning round in those seats, and giving your families and supporters a round of applause. Good. So Royal Colleges set standards. That's part of our ethos. That's what we do. And our Royal College has been doing that for the last 424 years, since we were founded in the year 1599 by Master Peter Lowe. He was a Scotsman who travelled to France and there learned the art of surgery. In those days, one learned surgery. The Hippocratic dictum is that if you wanted to learn surgery, you had to go to war, because most surgery was carried out on the battlefield or around the battlefield. And he was there during the religious wars between France and Spain, and he returned here to this city of Glasgow about mid-1590s, and he found the standards of medical practice in this city to be wanting. At that time, the population was about 7,000 people here in Glasgow. We're now, the city of Glasgow, maybe 700,000 or a bit short of that. The wider conurbation, 1.5 million, and probably about 2.5 million people live within 20 or 25 miles of this city. But the college is not just a Glasgow-based organisation these days. It once was, but we are an international fellowship, as I mentioned, in over 100 countries, of 16,000 fellows and members. And you are now part of that community, and we welcome you to that community this evening. And there's pomp and circumstances to make a bit of a fuss of you. As I've said, you deserve to be made a fuss of. But remember too, those people sitting behind you who have supported you and helped you get this far in your lives and careers. Setting standards is an important task for Royal Colleges. Our Royal College is a bit different from others because, as you see from these widely varied colours of gowns, from yellow to green to purple, we have several faculties. In the UK, there are 24 Royal Colleges and faculties, and most of them just do a single thing. The Royal College of Psychiatry, as you would imagine, deals with psychiatry. The Royal College of Anaesthetics with anaesthetics. But we're a college of physicians and surgeons, and I suspect one day we'll be changing the name to physicians and surgeons and dentists and podiatric medicine and travel medicine specialists. But at the moment, physicians and surgeons in the name, but we're multidisciplinary, and that's an important concept for all of us working in healthcare, to recognise that we can't do it alone and that we need to function as members of teams. Sometimes those teams are of the medical or dental or other professions, but also we need to work with everybody else in the hospital, with our nursing colleagues, our AHP colleagues, our administrative colleagues, and even sometimes, though it's very challenging, with our management colleagues. So we have to work with everybody who helps us provide good care. And so we're proud to be a multidisciplinary college and celebrate multidisciplinary practice of medicine. Setting standards is not all that we do in the college. We also help with education and continued professional development. And it's important that you remember tonight, and I'm sure you all know this only too well, that clutching that diploma is not the end of learning. It's not the end of you striving to learn more about your specialty and to deliver exceptionally good care. So we're here to support you in doing that also in education, not just in your specialty and subject matter expertise, but also in the wider aspects of being a healthcare professional, in being a good trainer, in being a good educator yourselves, in knowing more about how you can provide good care by looking after yourself as you go through your careers. So these are the wider functions of a Royal College. And also we have an important role in using our voice. Any one of us as an individual speaking, no matter who we're speaking to, will only speak with that authority or that voice of one person. But as a community here in the UK of 10,500 fellows and members who are delivering healthcare in the UK, we have a big voice in speaking to governments, in speaking out for the issues that are important to you in healthcare. And we also have a voice when we travel internationally, and earlier this week I was in Malaysia, where I met representatives of the medical school, the university, the Ministry of Health and others. And we have a voice in speaking up for good standards of care, not just here in the UK, but all over the world. And as well as doing that, we have begun to use our voice in other ways to talk out about issues which don't seem at first glance to be entirely about the provision of healthcare. We talked last year a lot, and we're continuing to talk actively in our college and do things about the sustainability and climate change issues which are there in our daily media. We have a role as healthcare professionals in doing our part to reduce carbon output. About 4% of the total carbon output from the UK is produced by the NHS, and 2/3 of that, I'm sorry to say for the surgeons in the audience, is in the operating theatre. So we need to take note of our role as citizens, as well as healthcare professionals, in doing something about working in a more sustainable way and using less resources and producing less carbon. And last week, on Thursday of last week, a week ago today, we held the annual President's Conference, and we held that on inequalities in healthcare. All of you providing healthcare know that we have a gradient of outcomes of human health. In this part of the world, in the UK, average life expectancy is around the age of 80. In this city of Glasgow, it's some 10 years short of that on average, because in this city, the 7 poorest parliamentary constituencies in the UK are here in the city of Glasgow. And you might ask, well, what's that to do with healthcare? It has an awful lot to do with human health. 20% of the outcomes of human health and longevity and living healthy lives is provided by us as healthcare professionals. The other 80% is provided by the society that we live in and the other wider social determinants of health. And so we are using our voice to speak out about that, because that too is important to our patients. It might not be something we can deliver for them individually as healthcare professionals, but it is something that we can speak out about, and we can remind ourselves as we see a patient in front of us that there are other things going on in their life which may affect their healthcare. We have been speaking out very consistently as a college about workforce, and I was delighted to see first thing this morning a press release from the Scottish Government saying that the number of trainees in all specialties in Scotland is going to be increased by 2.5%, 2.3% to be very precise, next year. And that's a great testament to our colleges speaking out about the importance of expanding the workforce. And indeed, when I met politicians in London, both from the governing party and from the opposition, they all understood, as I came into office 2 years ago, that workforce was very important. And we were delighted to see in July of this year the long-term workforce strategy for the NHS in England being published. And we strongly support an increase in the number of medical students coming through our medical schools and an increase in training places so that there are more healthcare professionals of the future to deliver healthcare, because we know our population is changing and becoming older and frailer and living for longer, which is good, but we need to look after them and look after that growing population. But it's not just enough to have more of us. We have to be able to work well. And that's why, as a college, we've been speaking out about workforce well-being. And you'll see here and there around the college, maybe encountered them already this evening, our little books of well-being. And that's because we want you to look after yourselves so that you can provide good quality healthcare through long, successful careers in which you thrive and are not simply suffering. Because at the moment, the NHS workforce is suffering. Normally in a population, about 17 or 18% of people will be expressing some degree of anxiety or depression, sometimes called common mental health disorder, not necessarily going to see a doctor about it, but they're just struggling with aspects of their daily life. That figure is nearly 3 times that number of 17% in the NHS. Most surveys come in with a figure of between 45 and 50% of our healthcare providers are themselves not terribly well. And as many of you will recognise and know of cases, that means that sometimes people are really struggling. It's estimated that a third or so are exhibiting signs of post-traumatic stress disorder, and very sadly, a quarter of all those providing healthcare are suffering with addictions to alcohol or drugs. So we're not very well. And therefore, we as an organisation are encouraging you to think about being well and looking after yourselves, because you're going to take on a lot in your careers in healthcare. It's a big burden. So look after yourselves. And I usually at this point give you 5 tips, because it's quite easy to remember 5 things. You've got 5 fingers. One is to notice what's around you, to notice the world you live in. It's very well known that green spaces, parks, lawns are very good for our mental health. Blue spaces, even better. Rivers, lakes and the sea. So notice what's around you, even in an urban environment, noticing the urban wildlife of squirrels or sparrows. The second thing is to be active. Try and keep fit, be active. That is very good for our well-being. The third thing, difficult to hear this evening, is learn. You've got to keep learning, I'm afraid. We've mentioned that in a healthcare perspective. But don't just learn about healthcare. Don't just read medical journals. Read some books, some poetry, some novels. Go and see and learn about other things. Develop some hobbies and other interests that will sustain you in your careers. Also sustaining are those people up behind you. Remember to keep connected to families, to friends, to neighbours, to faith groups, whoever, clubs. Keep connected to other people, because that will sustain you in your life and therefore in your career. And the fifth thing is to give. Now that seems a very counterintuitive thing to say when I've just told you that all that giving and providing of healthcare is bad for your mental health. But actually to give and to do things for other people does make us happier. That's why you chose to become healthcare professionals in the first place, because you recognised your capacity to give and to do things for other people. And remember that however hard your day has been that day, that the person in front of you in that consulting room, in that dental surgery, in your surgery as a podiatric medicine specialist, that person, you are the big moment in their life. And try to be the very best healthcare professional that you can be. Some of you will have noticed in the newspapers that yesterday was the 60th anniversary of President John F. Kennedy being assassinated in Dallas, Texas. On the 20th of January of 1961, he gave his inaugural address. And very famously, the words, "Ask not what your country can do for you, but rather ask what you can do for your country," was embedded in that wonderful speech on that cold winter's day in Washington. The college is not just here to do things for you and to examine your successors, to maybe do the next exam in your career. It's not here just to educate you, it's a community. So connect to us, be part of the college. I sat, not in one of those seats, because I don't think we had those seats at that time, on the 3rd of December 1991, and I got my fellowship, and my mum and dad were up behind me. That was a very important day in my life. 30 years later, I became the president. So maybe one of you one day, in 25 or 30 years' time, will become the president. Only one of us gets to be the president at any one time. There are other jobs to be done as educators, as examiners, as contributors to our public policy. So tonight, celebrate, but think also, what could you do? How could you be involved in the community which is your college, and connect with us? Thank you very much. Congratulations again. And I think we'll all stand up and process out. How's that? And come and join us upstairs for some celebration.